the Contagion-Clean product is a product that has started about 4 weeks ago. We have initiated a process where we're helping the public to stay away from the COVID virus itself. And if you look at the screen right now, you're looking at a closed due to coronavirus. And as we're starting to progress through the reopening scenarios that are happening, there are a lot of things that are going on. There are a lot of companies that are starting to pop up that have basically begun promoting that they can kill the virus, that they can do different things. Our biggest suggestion right now is for people to look at what's going on, to look definitively into what they're purchasing. Our product right now is one of the very few that is EPA certified to kill viruses like the coronavirus while being non-toxic. So that's one of the things. If you look at a lot of products that people are putting out right now, if you look at, excuse me, the way that they're being promoted, they're being promoted as killing the coronavirus, but they're also very toxic to the environment. Our product isn't. So one of the things that we need to look at is, you know, what are we going to do once this peak gets done? Now, we're on the backside of it, supposedly. I hope that's the case. But how are things going to change once we get through the major part of this? You know, we should start looking at basically the products that we're using now. How are they going to affect things in the future? You know, are you going to be utilizing a solution or a process that in the future is going to cause you an issue? You know, it's baffling to me that people look at the internet and don't do their due diligence. You know, websites will say they're a cleaning company. Well, cleaning is just removing the dirt or surface contaminants that are on the area that you're looking at. Where sanitizing is the next thing that a lot of people use, the word sanitizing. And sanitizing, as it's saying on the screen, it destroys some of the bacteria and viruses, but it's not an effective thing to do. Sanitizing is something that they use in the food industry. When you go and you have dinner at a restaurant and whatnot, which we're getting back into, thank God, it kills. They're using that to dip their glasses so that if you had something to drink from that glass, that it's basically clean, but it's not disinfectant. Disinfection is a process that kills the majority of bacteria and viruses on a surface. So you have to look, when you're looking at a product or you're looking at a company that is now providing services in this pandemic, you have to look at and see exactly, because there's a great fogginess to what's going on, whether or not you're cleaning, whether or not you're sanitizing, whether or not you're disinfecting. A lot of people are utilizing all those words simultaneously, and they're not the same thing. We disinfect, we destroy bacteria, we destroy viruses. The majority of people out there are utilizing the words sanitizing and disinfecting interchangeably. They're not the same thing. If you buy a sanitizing solution is going to help in preventing the virus, but it's not as definitive as getting somebody to come in and disinfect your facility. We're one of the few products in the marketplace that we've got approval for. The main ingredient for our solution has been approved by all three, CDC, EPA, FDA. It's fast drying. A lot of products that you're going to see on the marketplace, they take a considerable amount of time once they're sprayed. You cannot let people back into the facilities for a prolonged period of time. Ours is you can actually spray, let me back up, you can actually spray the solution while people are in the facility. It's non-toxic. It's not going to hurt anybody. It's proven to kill bacteria. It's proven to kill viruses. There's a thing called log, and a log is when you look at a number. Lysol and some of the other products say they kill 99.9% of viruses. Ours kills 99.9 and then goes 6 places over. So it's as clean as possible without making it sterile. You're never going to make a surface sterile unless you're in a hospital system or you're in some type of manufacturing facility that there is no, but that would require people wearing suits and special masks and whatnot. And at this point in time, I don't think anybody in the public wants to be wearing a hazmat suit when they go out to dinner or anything like that. A lot of the things that we're seeing on the market also have a large alcohol base to them, okay? And right now you're saying that things have to be at least 70% of alcohol to effectively kill the virus. Well, if you think about that, if you put something on your hands or on your table and it's 70% alcohol and for some reason a flame comes near that, what's bound to happen? It's bound to catch fire. Yeah, you're going to have a flame. Ours is non-flammable. Ours is non-corrosive. Some of the products that use a hypochlorite product actually is corrosive. So if you spray it on any metal surfaces and whatnot, you're going to have breakdown. Our product is made 100% in the U.S. You're looking at products that aren't made in the U.S. I would just caution you against that because you don't know exactly what you're going to be getting into. We have done things as far as our consumers so far. We have done first responders. We've done schools and police stations. We've done country clubs. We've done golf clubs. We've done medical offices. We've done restaurants around the area. Funeral and nursing homes have already used our product. We're open to just about anything. We're open to residential and commercial applications. So one of the things that we've done so far is if you go to our website, we have an opening guide on our website. It basically tells you the general steps that you can utilize to safely open your business or to take a look at your home. We hope that everybody looks at it whether they use our product or not. It's there for the general public to get an idea. It's one of the things that we feel Contagion-Clean does very well is we're not just in the marketplace to go out and make a buck. We're also here to help people. So, you know, when you're looking at things and you're at keeping it clean, you have to get one of the things that it is hygiene that is the most prominent thing with this virus. It's keeping things clean that is the major concern, whether it's your hands, whether it's a surface and whatnot. There have been multiple things that have been out there so far that says, you know, well, you're not likely if you're going to touch a surface that you're going to catch the virus. And then 2 minutes later, they're saying, yeah, if you do touch the surface, you're going to catch the virus. Basically, the biggest thing that we can say is that our product will help reduce the likelihood. There is no product out there on the market right now that is 100% going to kill everything all the time. You have to look at reducing the amount of virus or germs going forward. You have to look at that. It's important that everybody realizes that. Everybody's looking for that magic bullet or that magic solution that they can spray and everything's going to go away. There aren't those solutions. There isn't at present time anything in the United States that we found in our research that shows that there's any length of time that has been proven to kill the virus for any length of time. It's a majority of products are saying that they're at least, a minimum of so many days. That's that's really not possible at this time. So, you know, we have this this acronym that we've kind of come up with, and you know, as far as keeping it clean, our thoughts are that you do this. You look at the word clean and you start with the letter C, and that's create a plan of action. Okay, so you're going to when you're starting your business up, you're going to look at how your businesses can have social distancing. Do you need to move furniture? Do you need to do whatever? You know, reorganizing your floor plan so that you can maximize the space within your business, but still provide a safe environment to your customers. Not only your customers, but you have to also think about your employees. Okay, what can you do to make that area safer? Okay, do you need to maybe adjust break room times so that there's only 2 people in your break room because your break room is so small? You know, that's something that you're going to have to, as a business owner, make sure that you have proper time for your employees to go in and out of the room without closing down that 6-foot barrier that we've all been talking about. One of the other things is having hand sanitizers available throughout your business. That's tantamount right now, because not only do your customers feel safer if they're seeing that you have the hand sanitizers present in your facility, but your employees then can utilize it and maintain things like that. The other big thing is everybody needs to think about hygiene, okay? And when I'm talking about hygiene, I'm talking about cleaning. So you need to be putting up scheduled cleaning times. Before it was, well, the bathroom's dirty, I need to go take care of it. Well, now in the pandemic times, it's not just, oh, let me go and do that. You need to actually set up times and set up a schedule and timelines as to when somebody's going to be in that facility and cleaning.
So Bob, that's so just want to reinforce the need. A plan and discipline is still required, even though you could have disinfecting and killing the germs. That doesn't excuse anyone from having a plan of action and proper documentation, correct?
That is correct. That's one of the things that is coming out in the governor's guidelines, is that as you reopen, you're going to need some type of physical plan as to what's going on, how you're going to be proactive, not retroactive in this situation. So if we go to we just talked about the C, now we're going to go to the L. The L is when everybody's looking at this, whether they look at our product, whether they look at another product, and there's a multitude of things out there. Whatever makes you feel comfortable is best for you and your business. But you need to look at in depth. This isn't something you can just go and talk to your buddy about, or maybe go and look on the internet for a couple minutes. This is something that business owners really need to do their homework on. They need to look at things and see whether or not a product has what type of approval, whether it's the CDC, the EPA, the FDA. There are multiple people coming out right now. The federal government has allowed something to occur, which basically says that if something is in your product and it kills similar to a product in the past, and that product killed a similar virus or a similar bacteria, then you can say that it kills COVID. So you're on the approval list, but you're on the pending approval list. Okay, so you have to look. There's only a handful of disinfectants and cleaners that are on the market right now that are on what's called the N list. That's the list that right now is the list that everybody wants to start looking at. If your cleaning product, if your sanitizing product, if your disinfecting product, and we just talked about that, the difference between cleaning, sanitizing, and disinfecting. If those products are on the N list, you're using products that actually work on COVID. So you must read the labels. The thing that makes Contagion-Clean a little bit different than most products is most products that you look at, and if you go to the N list and you see, they will kill the COVID virus, okay? but they come with consequences. If you look at the back of the bottle that has to list exactly what the ingredients are and if there are any type of warnings that are listed. If you look at some of the products, they can clean your facility, but are they also posing harm to your customers and to your employees by using them? Our product doesn't do that. The other thing that's going on right now is a lot of companies are saying that there's a process called wiping, okay? And we all know what wiping is. It's, you know, you spray the solution down and then you take a rag and you wipe across the surface. Well, they've just recently come out with some studies, and they're showing that in the event that you use that type of process, unless you are, paying super attention, it only takes away 35% of whatever bacteria or virus you have on the counter. So if you spray your solution down and you take a washcloth and you wipe it down, you're only taking away 35% of the probable pathogen. So that's one of the things that you want to look at is how you're applying the solutions. One of the big things that people don't understand is that when you put the product down on the surface itself, there's a thing called dwell time. And dwell time is how long you have to let the solution sit on the surface. When you look at some of the products, they take up to 10 minutes to kill. So if you're using a product and you're spraying it on the surface and immediately wiping it off, are you doing anything? Yeah, you're doing a little bit, but you're not doing the maximum that you want to use the product for. A lot of places now have converted some of the equipment that they used to have to doing fogging. You'll see that as a key phrase that a lot of people say, oh, this company is going to come in and fog my place. Well, fogging is good in super large venues, but in the majority of places around the Youngstown area, that fogging is not the ultimate way of putting any type of solution down. Because what does fogging do? Fogging blows out a fine mist that goes all over the place, and you can't guarantee that when you're fogging something that you're covering all the surfaces. So when you fog something, excuse me, you're not, while you're doing an adequate job, you're not doing the best job possible. So the process that we use actually directs solution to areas, and due to some physics that I won't get into right now, they actually wrap around the products. So if you have a door handle and you spray it with just a conventional spray bottle, what happens? You get the top of the doorknob wet, and then it basically drips around to the side of it. Our spray is such that when we spray it on such a door handle, it actually covers the entire surface. It's not hopefully going to get there by somebody, it dripping or rolling around the surface itself.
Right.
So,
Bob, if I may ask a question before we move on to the E. So learn the differences in products. You referenced the N list as in the letter N, as in Nancy?
As in Nancy.
Okay.
That's a list that you can go and you can look up on the internet itself, and it lists products and the products that have been approved so far in regards to fighting the pandemic.
Okay.
So it's a list that I would, go ahead.
No, that's good. So I will find that N list and link it up here in the notes. Also wanted to clarify something around labeling. How stringent are the guidelines? And is the FDA involved in labeling, the EPA involved in labeling? I mean, I'm looking at a lot of consumer products, and you're right, consumers aren't aware of the difference between cleaning, sanitizing, and disinfecting. And how stringent is the labeling, and how can organizations get away with not maybe mislabeling, but misleading the consumers?
Well, that's one of the things that, as of right now, when with the pandemic, prior to this, there were fairly stringent guidelines that you had to adhere to if you brought a product to the marketplace. Those have been relaxed a little bit And it's the same thing that you're seeing with the testing for COVID and whatnot. We've relaxed things. The masks, let's take for example. Masks originally for healthcare workers had to be utilized and thrown away once you use them. The N95 mask. Now we're allowing things to happen where you can apply a chemical to them, or you can use a UV light, and they can be used for longer periods in time. It's out of necessity that this is happening. So, but it's also allowing the people that are, how do I say it politically correctly, not so forthright, to find the loopholes and utilize those loopholes to make some money. So it's up to the consumer to be very wary and do their due diligence when they're looking at things like that. So we've gone C, L, we're up to E, and that's expect the unexpected. Disinfecting is not a one and done, okay? As much as we would like it, there isn't a product out there right now that gives any length of time in regards to the COVID virus. There are two things across the ocean, we'll say, that right now have been proven to kill for prolonged period of times. One of them is out of Israel, and the other one is out of Hong Kong. One of them is a solution called MAP, M-A-P-1. It hasn't been approved in the United States as of yet. We hopefully will get it here, but that gives 90 days of kill time. Right now, we don't have that availability in all the research that we've done, and we've been doing a lot of research on products. We haven't found anything that has definitively killed for prolonged periods in time. That's the magic question that every consumer right now is asking is, well, how long does this product last for? It lasts for as long as someone that doesn't have COVID doesn't touch the area. So if we come in and we do a clean, and 5 minutes later, an individual walks in and you haven't done your due diligence as a restaurateur or as a business owner, and you haven't done their temperature and followed the guidelines that the CDC has put forward, and that person touches that surface is again contaminated. There is nothing out there right now that provides any length of time. There are a couple products that we've seen and we're looking into and we're doing some research on right now that are saying that they do, but basically they have proven that that characteristic for bacteria and not the COVID pathogen itself. So can we think that possibly could happen? Sure, I'm not saying that it's definitively what some companies are saying isn't true, but again, it hasn't been proven with the COVID. There hasn't been a lot of research specifically on the COVID virus and what kills it, what doesn't kill it. We're doing it based on a general formulary where we're looking at the type of virus that it is, an enveloped or a non-enveloped virus, and what type of viruses kill that. And then we're also basing our information on viruses that are much harder to kill, and we're using solutions that kill those viruses, and we're utilizing that to kill COVID. So you have to look at all of that. A lot of processes, they'll say that, well, our process is the best way to spray for your facility, or our solution is the best thing for your facility. Contagion-Clean not only does a solution and sprays a solution in a specific way, but we also do things with your HVAC system to help you circulate air better. We provide, if you choose to go down that route, there's things called UVC lights that have been in the past utilized to kill in healthcare facilities to kill pathogens. We also can set you up with that. So we just don't always provide just the one product. We look at what product is best for your specific facility, and then we make recommendations based on that. So when you're looking at companies, you also have to look at, are they trying to push just one thing? The better companies are going to come into your facility and show you what is best for your specific facility. It's not, some people will come in and say, okay, well, we've cleaned your thing. Here's a bottle of solution. This is up to you to maintain the surfaces and whatnot. Well, that's a very nice selling point. But if you don't know how to use the solution and where to spray the solution and how long the solution needs to set on a thing, that really does nothing. So it's just not enough to leave just solution behind or just sell you solution. There has to be some teaching behind it. And you want to look at the companies that are coming in and actually helping you be better at what you're doing. And that's what Contagion-Clean does. Contagion-Clean will come in and not only help you pick the best solution or to pick the best, and when I'm saying solution, I'm saying overall solution, whether it's the UVC light or a liquid to spray. We're going to do that, plus we're going to help you to apply it in the best manner. Our solution specifically is a solution that you spray on the areas that you want to, and you let it sit. I'm sorry, not sip. You let it sit. That has to sit, and that's called a dwell time. I spoke about that a little bit earlier. Our product is designed to spray onto a solution or spray onto a surface and kill for a prolonged period of time. You don't want to touch that area. You want to let the solution do its work. Okay, a lot of places are going to spray and then they're going to think that by wiping it, that it's a better thing. The only thing wiping does, and the only thing you want to do with wiping, is to remove the large particles. You want to clean the area before you disinfect. So that's the big thing. You have to understand that when you spray a solution on a specific surface, it needs to sit there for a certain period of time. And that you should be looking at the back of your bottles, whatever you're utilizing, and looking at it and saying, okay, in order to kill just germs, maybe it sits for 30 seconds. If you want to kill viruses, it has to sit for 5 minutes. So that's something important that everybody has to start looking at and understanding. Some of the products that we use in our homes, we think that just by spraying or wiping down the surface after you get done cutting a piece of meat on the table, that you wipe it with this special cloth and magically all the germs are killed. Well, that's not the case. That area has to stay wet for a certain period of time. Some of the solutions that people are using right now have to stay wet, physically wet, for up to 10 minutes.
Wow.
So I'm sorry?
I said, wow. No, that the dwell time is critical. And that's also something, once again, there's a lot of misinformation that has been spread in the marketplace. And is there a difference between neutralizing and destruction? So does the bacteria get neutralized or destroyed?
Well, here's the thing. That's one of those terminologies that I was just talking about a little bit ago that everybody kind of blends together. Neutralizing a bacteria can mean a couple different things. Neutralize can mean that you basically put a barrier down and you're not able to touch that virus. That would be one way to neutralize. But also people utilize the word neutralizing to mean that they've effectively killed the virus. So that's kind of one of those gray type of things where, it depends. Unfortunately, I can't say definitively, but when you say disinfecting, that means that you're actually physically disabling the virus, you're killing the virus. So that's what you want to kind of look for, at least in the conversation that we're talking about now. The other thing that with our product, when you're spraying it down, you have to think about, if you use some products that are out there, you spray one product, you wipe it, which I don't agree with, and then you have to put another product on top of that, and you have to spray, and you have to wipe that spray down. So if you're thinking about it from a business standpoint, if you're paying somebody in your facility to do that, that costs time, and time is money, right? Our product, you can go in, you spray it, you leave it, you're done, go to the next site. spray it, leave it, done, go to the next site. So it actually saves you time, and then it saves you money by doing that. So you're not paying somebody to do the job 2 times or 3 times over. It's just sprayed, let it sit, go to the next spot, spray. The only thing you have to maintain when you're utilizing our product, if you're utilizing it on your own, is you have to make sure that you cover a surface completely. That's all you have to worry about. You don't have to worry about any of the other things. You're not worrying that you're only wiping off 35% of it. You're not worrying about that you're sending 2 people to do the job. I just watched at a facility the other day, and they sent 1 kid through spraying, and he wiped, and then there was another boy that came in behind him and sprayed and wiped again. You're using 2 people. It doesn't make sense to do, things like that. So you have to understand that, that time is money.
Right. And so just wanted to clarify also on empowering the organization. So you come in, you spray, and allow it proper time. So there is an ongoing maintenance opportunity for the individual organization to maintain a surface once you do the complete cleaning, correct?
Correct. That can be done by us or can be done by them. Most places right now feel that it's cost effective through a process that we have for them to do the day-to-day hygiene, and we don't have to come in. And then we come back. We typically do anywhere from 30 days. We come back in and we do another deep clean so that you know that your facility is completely disinfected, and then it's up to you to maintain that hygiene again. So that's the way we look at it. What's the most cost-effective way that you can do your things? One of the big things that, and it's right now, consumers, when they're coming into your businesses, they want to know what you're doing to make them safe. So, people feel more comfortable if they're going to see that you've gone over and above, doing something that, whether it be that you show them that you use such and such a process, or you put up a cleaning time sheet on your wall or something like that that shows that, you're doing this every half an hour, you're walking through. We've done things at different restaurants where there's you can see it on the screen as we're talking, that the table has been sanitized with utilizing our process. So when you sit down at that table that somebody has taken the time to utilize our product, utilize it correctly, and that table is presumably safe for you to sit down at. You don't know that if you've been at some restaurants and some places. You don't know that. So it's an extra layer that we put forth so that people know that they're sitting at a restaurant or they're at a facility that has been cleaned properly. You want to see things like that. At least I do, and I want my family going into places that I know just haven't, used whatever soap and water to clean the facility. Now, don't get me wrong, soap and water does a fine job, but it does take due diligence and a lot of practice to do it correctly. So, you have to look at a bunch of different things when you're looking at the end part of this, the clean part of this. You want to make sure that people understand that when they're coming in your facility, that things have been done. So however you choose to do that, that's an important thing right now, is making the consumer comfortable coming back to your facility. So again, it's due diligence on the owner's part to make sure that they have the proper equipment and they're doing the proper things to make people safe coming into their facilities. Like I said before, when this is, the cartoon says it all. When this is over, what should we change? Everything. And that's world right now is we need to change everything. We need to change the things that we haven't thought about in the past, that things that are going to make us better for the future. I know for myself that, if I went out and worked in the yard If my hands weren't physically dirty, there was a high probability that I was going to run them underwater, and that was going to be the extent of my thing when I was eating dinner. Now I know it's in the back of my mind that if I go out in the garden and I'm doing work, I come in and I do the 20-second hand scrub, and I may even use hand sanitizer on top of that. I think that's what we're headed towards, and we're going to continue to do in the future. So, that's where I'm at. So if there, anything that you want to add or ask, feel free.
Yes, absolutely. Thank you. This is really helpful information. Lots of insights that, once again, that consumers are not aware of, and just helping us understand the difference between cleaning, sanitizing, and disinfecting, and dwell times, especially. Dwell times are an area that, once again, I'm looking at the label of a consumer product, and it's unclear unless I get my my telescope, or not even, I don't even know what, I can't read is basically the problem. So dwell time's an issue that I think we have to be aware of.
You need a magnifying glass to read that on a lot of products, and they make it small for a reason.
Right.
So, yeah, it's definitive that when you're looking at a product, whether it be for your home or your business, that you need to take a little bit of time and read the back of the product and see exactly what it is. Because I was astounded when I first started looking into this business. We were at a country club, actually, and I looked at what the country club was using, and at the very bottom of the bottle that they were using, it said not safe for humans or animals. And I thought, oh, dear God, why am I sitting at this place? And,
right.
So, that's kind of what spurred myself and my business partners to start looking into some things, is because of just that. I mean, it was like, wow, that was an eye opener.
Right, absolutely. So someone with medical training, here's a question that came in that is fascinating. Is there a danger to long-term exposure to products, to sanitization products or chemicals over time?
I would venture a guess to say that we're going to find out that there are going to be some issues down the road. And that being said, one of the reasons that we went with our Contagion-Clean product is our product is non-toxic. It poses no problems from that standpoint. There's no buildup. A lot of the products that we're looking at now, one, build up on a surface, so you get buildup. So what you end up doing is you end up cleaning the disinfecting solution off because you're putting a biofilm layer down on top of whatever surface it is. So that's going to be one of the things. The other thing is that most things that are created, and this is something that the COVID has brought to the forefront, is that most of these things weren't designed for prolonged use.
Right.
The things that are out in the public right now weren't designed for you to use 3 and 4 times an hour. They weren't designed that way. But we're utilizing that because that's the best thing we have available right now, is to use, at that time, that was the best thing. Now, there are better solutions coming out. There are better products coming out. But again, it's up to everyone to do their due diligence and see what products are best. So to answer that question, to revert back to the answer to that question, I do think that in the future, we're going to see some things that are going to be unsavory. Let's put it that way.
Interesting. That accumulation could create long-term ill effects. Interesting. How about? Go ahead. I'm sorry.
No, I was going to say, my background is I'm formally trained as a nurse anesthetist. Okay, so I do anesthesia, and then I went back and got a Ph.D. So, I would like to think that the combination of having some medical training and some educational training is kind of like the perfect thing to kind of do some research and whatnot. So, again, that's my personal belief, that I think that things are going, we're going to end up with some issues, and there hasn't been anything definitively out there saying that in writing, but that's my own personal view.
Right. So how about individuals that are advocates of natural immunity? Is that a risky game to play at this point?
Herd immunity has been proven. I mean, it's been proven in the past. The thing about that and COVID is this is such a unique situation that we're in. I mean, the last time that we had something like that was, what, 1918? That was 100 years ago.
Right.
So herd immunity has been a way of thinking of things in the past. I don't know. I think, and again, it's my own personal viewpoint. It's not, I don't have research to back this up. I think that we're going to need herd immunity, but definitively, I don't think there's anything out there. I don't think there's been a study that says yes or no. You know, Sweden has shown some benefit to that. I mean, they've proven that. There are studies in the making. I think that's going to be something that's going to be talked about not too far in the future, that, you know, we need to do things. This is a unique situation. This is a unique virus because of its virility. So there's pluses and minuses to herd immunity. And, you know, I think it has to be studied a little bit better.
Right. Okay. And the last question that we have today, what is the most interesting place you have ever cleaned, sanitized, disinfected? Share a story of something that was so shocking or surprising to you.
Honestly, I'd say I don't think there's a certain place that I went into. The thing that I think most that was most amazing to me is going in and starting this business is to see, again, go back to the thought process that people didn't understand what they were doing in the past. So they thought they were doing things that were very good, but in effect weren't a proper way of applying sanitizers or disinfecting solution or even simple cleanings. Right. I think that was the thing is when I went in and started looking at this overall and started going in and I started spraying originally with the company. And when I would go in and spray a place and, you know, you'd go in and spray and it would be a place that I would think, okay, this needs to be a high touch area. But when you would look at it, there'd be a level of dust or something on it. But yet they were told that they had a cleaning company in 2 days ago. But everybody was okay with that level of cleanliness. And now everybody's hyper vigilant on, you know, did you touch that spot? Did you do that? And we need to be. Not that that's a bad thing. We need to do that. But I think that's the most unique thing that I saw was that we were very complacent.
Absolutely. No, that's good. Well, this is a good, if not a wake-up call, some practices to implement over the long term. And so especially your CLEAN acronym was very helpful. So we will be publishing the full recording and also the notes and a write-up of this webinar with this depth of information. And I see your contact information here on the screen now. Best way to reach you, all three of the above items here?
Yeah, that would be fine.
Okay. Well, I think with that, we sincerely appreciate the education we received today, the importance and the role that, you know, really a safe and healthy reopening plays, not only in a vibrant business, protecting your customers, protecting your employees, protecting your vendors, and really this is about instilling confidence that an organization that embraces this Contagion-Clean process really has a great commitment to all of the above.